Healthcare System Reform: Returning Power to the People by Jared Clark. Anyone who has had to stay at a hospital in the United States knows that the quality of the care is usually good, but it comes at the cost of being both expensive and complicated. Healthcare is so expensive that health insurance is basically required, but getting that insurance, and preferably the right kind, can be difficult. According to an article written for MIT Medical, a 3-day stay in the hospital will cost approximately $30,000. Most people cannot afford this, and this is why a lot of people choose to go without health care, even when they need it. The power dynamic and trust between healthcare workers and patients is arguably flawed and can be abused. A for-profit healthcare industry can be beneficial, but it can also be detrimental. Unfortunately, no healthcare system is perfect, and big changes can be both expensive and time-consuming. However, experts agree that healthcare reform in the United States is necessary, inevitable, but a hard target to hit. The power dynamic in the United States healthcare system has become one that values profits over patients. According to an article written for the National Library of Medicine, hospitals need physicians bad enough that if a doctor requests expensive equipment, they typically get it as a way to attract or keep their physicians. But this creates a medical arms race where the hospital's costs are higher and they commonly have unnecessarily expensive equipment and in excess. This shows us that the power dynamic between hospitals and doctors is skewed in the favor of the doctors. Typically, it is the employer who tells the employee what to do and how to do it, not the other way around. In the book, The Sociology of Health, Illness, and Healthcare, Rose Weitz explains that pharmaceutical companies are typically the ones providing doctors with new information after they graduate, and their salespeople meet with doctors at least 4 times per month on average. These salespeople are known for giving extravagant gifts to doctors, and the doctors pretend that these interactions do not persuade them in any way. In general, it is probably a bad idea to take anyone seriously when they are trying to sell you something. This shows us that the power dynamic between pharmaceutical companies and doctors is skewed in the favor of the pharmaceutical companies. If the pharmaceutical companies, who are money motivated, have control over doctors, and doctors have control over hospitals, then in a roundabout way, the pharmaceutical companies are actually the ones controlling our hospitals. This is a disturbing reality that seems very dystopian. The United States healthcare system exists on a razor's edge, with inherent flaws at every level. According to an article in the Journal of Economic Perspectives, the fragmentation of the United States healthcare system between patients, healthcare workers, hospitals, and insurance companies slows down improvements in hospitals, creates a myriad of inefficiencies, and creates unnecessary waste. Simply put, there are too many things involved in this healthcare system for it to function appropriately and effectively. To make matters worse, according to an article in the American Journal of Public Health, this system is also lacking in responsiveness, accountability, and foundational capabilities. This means that getting health care in the United States is slow, inconsistent, and if something goes wrong, it is not likely that anything will be done about it, because no one is willing to take the blame or responsibility. For example, my grandma spent 6 weeks in the hospital, and while she was there, she ended up getting MRSA. The healthcare workers recorded this on her medical records, but chose not to tell us. We later discovered this on our own while trying to find something else on her medical records. In an article for the New England Journal of Medicine, Dr. Jamie King explains that approximately half of Americans are getting their health insurance through their employer. But when something like the COVID-19 pandemic happens, unemployment skyrockets, and most Americans are left with no health insurance, which is an especially big issue in the middle of a major health crisis. This system is simply unsustainable, and if nothing is done about it, it can only get worse. This leads us to the big question: what do we do now? Unfortunately, a healthcare system is a complex subject, and I cannot say that I have all of the answers. I can, however, provide a few points as food for thought. In an article for the National Library of Medicine, John McDonough points out that while the United States healthcare system may be leading the world in regard to innovation, it is lacking in governance, management, and worst of all, the ability to learn from others. Globalization is not a one-way street, and it is best for everyone when all participants both give and receive. If nothing else, it can help minimize the trial and error process. In the book Benchmarks of Fairness for Healthcare Reform, the authors mentioned that other countries had taken measures to keep their GNP expenditure percentages below 10%, while the United States was at 15%. While decreasing funding for the healthcare system may sound bad at first, it would help minimize the profits over patients' motivations that currently exist, and like previously mentioned, this system is currently unnecessarily inefficient and wasteful, so in theory, it would cut costs but not necessarily quality. Another issue some people have when looking at other countries' healthcare systems is the risk of creating a free rider problem. According to David Cutler in an article for the Journal of Economic Perspectives, universal coverage would alleviate the free rider problem of people choosing not to buy insurance because they will still be treated on an emergency basis at little to no cost for themselves, and it would also encourage others to stop receiving government assistance like welfare because they no longer need the Medicaid benefits. The experts have agreed that the United States healthcare system has a backwards power dynamic, is overly fragmented, and unfortunately, there is no quick or easy solution. However, the United States is leading the world in innovation. It is made up of a diverse group of people, and if it can learn from others, then the possibilities are endless. The current healthcare system is not the worst, but it could definitely be better. A good healthcare system is similar to education in the fact that they are both good investments in the people and the future. It is an investment that is guaranteed to pay dividends, and while the return on investment may take a while, it will be worth the wait.